Hi everybody, it's Felice. Hope you're doing well today. Thanks for looking at my channel and thanks for the subscriptions and the likes. I really appreciate it. As I mentioned before, the reason I do this channel is because I like to fill in the gaps for people living with diabetes and other chronic illnesses. So when you go to your provider and they send you home and you're trying to figure out how to live and what you need to do and the social aspects of living with diabetes and a lot of things that I've encountered during my course of teaching people about living with diabetes, I want to, use that information to benefit people. So this is not a channel where you're going to learn what is diabetes, what do I do. I got a lot of questions from you all, which thank you for submitting your questions. There are no stupid questions. So my recommendations are: one, always refer to your healthcare provider. Recommendation number two, if you cannot get to your health provider in a reasonable amount of time, if you're living in a rural area, if you have low access to getting health care. But if you're looking at this, obviously you may have internet access. So you want to look at the American Diabetes Association's website. It doesn't matter if you live in other parts of the world. If you Googled American Diabetes Association, it will take you to the website. They have great information that answers those questions like, what is diabetes? What can I take for it? It would be reckless for me to sit on here and not know who I'm talking to and dealing with and make recommendations about what you should do, because that is not my role. My role and my choice doing this channel is to share and impart information that I have acquired over a lifetime of living with diabetes, over educating thousands of people with diabetes, and just having had a lot of firsthand experience with the illness. And hopefully, my existence is not in vain, because I feel like if I can't pay it forward, why did I go through the things I went through? So, and I'm doing well. I love my life. I'm happy. So I use myself as an example. I've had a chronic illness for 45 years. I'm 56 years old and very happy to say so, because I'm happy to be alive. So hopefully this will help you. Another benefit of that I hope my channel brings to you is to give you insight to things that you may have questions and concerns about that you may not feel comfortable speaking about. So with that being said, today I'm going to talk a little bit about diabetes and intimacy. I have had the fortune of being privy to a lot of different information from many patients who trusted me and were comfortable talking with me, male and female, regardless of their sexual orientation, about how diabetes affected them or how a chronic illness affected them. And when we think about intimacy, because when we think about who we are all divine human beings created by a power who I cannot name or know, but I know that there's a power greater than me, believe me. And it shows that power is evident and ever present. And I will never, ever not acknowledge that, because I know that I'm a miracle. So with that being said, there is a wonderful power that created all of us to be here. And we were not created to suffer. We were not created to be miserable. And we're human beings. And a part of being a human being is having needs and desires that human beings have. And one of those is a need and desire to be intimate for whatever reason. That is a not normal, because I really don't like that word, but that is a characteristic of humans. We eat, we sleep, we go to the bathroom, we procreate, we create, we do a lot of things. Human beings are wonderful. So, with that being said, first off, there is nothing wrong with you. There is nothing wrong with you. And I want you to really breathe that in. We live in a world, in a time where we are bombarded in every aspect of human existence, psychologically, politically, socially, in regards of wellness. How are we going to take care of our families? How are we going to take care of ourselves? How are we going to do what we need to do to be okay? That requires so much energy, survival, or persevering, or overcoming, or for some of us, thriving. We all can get to that part of thriving in the midst of adversity. So be encouraged. But there's nothing wrong with any of you. You are who you were created to be. And it's important that you know that. And I hope that if you've never heard that and never felt that, I hope you know that right now. You were created for a reason. You're watching this for a reason. I'm doing this for a reason bigger than me. But I'm doing it. And I work hard to make sure I'm doing it in the best way possible so that I'm giving information that makes other human beings feel purposeful. Nobody was created for nothing. No one. So, we think about the society we live in. I've had a lot of men, a lot of you guys have come to me as patients and talked to me about things you were going through. And there is nothing wrong with that. I have so much respect for my male patients, for having the courage. It takes courage as a traditional man to verbalize feelings of inadequacy or feelings of powerlessness or having to ask for help. But it's one human to another. One human to another. Doesn't matter if I'm a woman. It doesn't matter that you're a man. I'm a human being who cares. And part of my responsibility that I undertook is to help other human beings feel better. So when we think about how diabetes affects men and how hypertension affects men, we know that there can be some issues there. Because diabetes affects your nerves, it can affect your mental status. If you have an elevated blood sugars a lot, if you have low blood sugars a lot, then if you have high blood pressure, a lot of the medications that you take to maintain a blood pressure within normal limits may affect your performance. The key is with a little bit of discipline and determination, it can be a situation where you can still perform. You might not perform like you did as a young man or before you were diagnosed with a chronic illness. But the benefits of positive self-management of diabetes, eating well. See, that this is the thing about diabetes. It makes it such a slick sucker. Because see what diabetes will do. Diabetes will affect you mentally where you feel like, oh my God, I can't do this, I can't have that. But if you work hard to control the diabetes, guess what the hypertension does? It's a copycat. If you can control or get that bully diabetes under rein, hypertension follows it. They go hand in hand. They're two gang members that love wreaking havoc on your lives. So initially, Say if you initially diagnosed, I've had men come to me and say, I just found out I had diabetes. They knew something was up because they were having issues with intimacy. That kind of goes hand in hand. Especially men, if you are developing urinary tract infections, if you notice that you're having issues with discomfort, that's a part of diabetes saying, I'm here. And I will try to mess you up. But see, what diabetes doesn't like is people like me that can help you understand that you can improve. You really can improve. So what does that look like? So when you go to the doctor and the doctor says, I need you to take this medicine, hopefully they'll tell you why. And hopefully the rationale behind why they want you to take the medicine is for you to get blood sugar balance and for you to get your blood pressures under control. You might need to take some medicine for a minute. I've had a lot of men tell me, I don't take medicine. I don't take medicine. I don't take pills. Okay, that's your choice. But it doesn't mean that it has to be permanent. And if it is permanent, that doesn't mean that you won't be able to do what you need to do to handle your business. It's about balance. It's about understanding the self-value first. Because we all know that intimacy begins here. I've had many men tell me, when I have external, for lack of a better term, I have external stimulation. If I watch a video or whatever, I have no issues with being able to perform. It's just, when, I'm with my significant other, sometimes it's challenging. And therein lies the decision you have to make in assessing, the relationship that you have in terms of communication. In other words, can you talk to the person that you're with? Are they able to understand? Are they getting pissed off because they feel like, something is wrong? Or they're accusing you of cheating? You must be cheating because you can't perform. A lot of different things take place. And that's why communication is priceless. Some situations, communication can be an issue. Therein lies an opportunity where you might want to find somebody to talk to who can help you on a long term with figuring out the best way you need to deal with that. Some people their partners don't even know they have an illness. They try to hide it. I've heard about that. I've had patients tell me that. I don't want them to know. But then it creates a cycle of chaos because you're not being authentic about a valid physiological issue you're having. And so until you can be candid and honest and have a constructive conversation, it can be problematic. It can be destructive for the home life situation. And men, let me tell you, hail to you guys, because I tell you what, women, we have it much easier. Because we don't have to be like, hi, but you guys gotta be like, hi, or else it can be problematic. It can be an issue. But know that there's nothing wrong with you. A smart man is gonna see about himself. I know many smart men. I know many men that love their partner enough to just let it marinate and have a conversation with their partner. And oftentimes that brings you closer together. Because sometimes people can't help if they don't know. And if a person really, really cares about you, they'll work with you, you know? So we think about the doctor. When we go to the doctor, you get instructions. The doctor says, I want you to check your blood sugar 3 times a day. I want you to wear this device that will monitor your blood sugar and you can see where you are. And then I want you to, take insulin, even if you're type 2 and you're way out of control. If you type 2 and a doctor puts you on insulin, they are 9 times out of 10 going to get you where you need to be faster. And then you can work with it and make the lifestyle changes in a way where it's not overwhelming and it's not too much for you and your partner to deal with. I have spoken to patients alone. I've spoken to husbands and wives. I've spoken to partners and partners, male and females, same-sex partners. Love is love. And we all go through the same things. We want to feel loved and we want to be loved. And sometimes it just takes a conversation, and trust. There's nothing wrong with feeling, oftentimes they call it the John Wayne syndrome. They used to say that about, the doctors used to say that about my dad all the time. Oh, Mr. Mitchell has the John Wayne syndrome because he wants to be omnipotent. What man wants to feel like he has a chink in his armor? I don't know any. And there's nothing wrong with that. Who wants to feel like they can't be intimate with their partner and that they don't appeal to their partner? No one wants to feel that. So guys, when you think about what your doctor's telling you to do and you're hesitating about taking that medicine because you don't like how your body responds when you have to take, especially the high blood pressure medicine, remember, that can be temporary. Even though a lot of high blood pressure medicine you may have to take for the rest of your life, but there are different types and different kinds. And it still won't stop a thing. I promise you. So yeah, guys, I get it. I get it. See, one reason why I'm doing this is because I was at a provider's office the other day. And this provider begged me to have this conversation. This provider shared with me that the male patients, especially young male patients, were feeling as though that was a normal part of life at a young age, where typically that is not an issue. They're beginning to feel like, oh, well, that's just a part of the aging process. Well, you're not old enough to be having to deal with that. But the other piece is your provider's telling me that you don't want to accept the fact that you're living with diabetes or high blood pressure. It's treatable. The key is to have someone that you feel comfortable talking to. If you feel like you need to go and speak to a counselor about how to deal with this in your relationship, that's the best thing. You want to show somebody how much you really love them? See about yourself. Talk to somebody. Talk to an objective person who can say, you know what? I don't know you from Adam, but I know that you love your partner because you're really doing what you need to do. Will it happen overnight? It might not. But it will happen. So, as an example, I can tell you, I had a patient who was very very sick with diabetes, high blood pressure, and other issues. And the patient brought it up to me. And we had some very constructive conversations. So he decided that he was going to obey or follow the recommendations of his doctor. And the next time I spoke with that patient, his wife got on the phone and she thanked me. You got to be able to talk to somebody. It is not unusual to feel a certain way about being intimate, whether you're male or female. Women. So men, let me go back to the men. Try and do what your doctor recommends. See what your wellness provider recommends. Try the medicine. Try it for a couple of weeks. Try it for a month. And see how your overall wellness balances out. If you improve, good. Then you're on a road to being able to do what you need to do. Don't put pressure on yourself. You have enough pressure on you. And, I've had many men say, well, Felice, if I'm looking at something on the internet or whatever, I have no issue. But when I'm with my wife or, well, think about what you bring into your intimacy area. When you go in there, you're thinking about work, your bills. What somebody just told you 15 minutes ago that pissed you off. How you gonna deal with this? Oh my God, we about to get intimate. Oh Lord. And you panic. That kills it right there. Do you let it evolve organically? Or is it Wednesday night at 8 o'clock? Something better go down. Or my old lady gonna be coming after me with a butcher knife talking about I'm cheating. I gotta bring some humor into it. We gotta find the humor in things. We all human beings, man. We all do the same thing. We born, we live, and we die. What we do in between is up to us. So why not let it be enjoyable? So some things that men can do that can help with them. First off, follow your doctor's instructions. You might not like it. You may be angry. You may be like, what? I was in high school. I was the quarterback of the year, and I played basketball, and I ran track, and I was. Well, in reality, you are who you are now. There are a lot of solutions for men, way more than for the female persuasion. With a little bit of effort, you can do it. So I hope that's helpful to you guys. Follow your diets. Follow your doctor's instructions. Be honest with your doctor. Talk to him. Almost every wellness provider that I know and have worked with are very privy and regularly assist people, men, in that area. I could tell you a funny story. So once upon a time, I worked in the pharmaceutical industry. So they came out with Viagra. So a friend of mine was a internal medicine guy. He said, Felice, guess what? They came out with this new medicine and said it's supposed to work for women too. Well, he said, I'm going to give you a sample of it. I said, okay, I'm going to try it out. He knew that I was a type 1, family friend, physician. So I was like, okay. He said, whatever you do, just make sure you don't take it before a fatty meal. I said, okay. So sure enough, I took it. And I say within about 45 minutes,
I started talking like this. And I sounded like this when I spoke.
And it was because my nose got stopped up. So that was my experience. So
this is where it worked on me. It made my nose very rigid and it stopped it up.
So that's my Viagra story, y'all. I thought it was very funny. Some people, I tell, they laugh. Some people look at me like, oh my gosh. Well, that's fine too. So anyway, guys, be encouraged. I'll have more information as time goes by. Continue to send questions. I'm proud of you all for being forthcoming. And I'm humbled by the fact that many of you have trusted me enough to know that I'm going to give you the best solution and the best answers, to help you have a better quality of life. Hopefully you're going and you're seeing your wellness practitioner and you're having a dialogue with them and you're able to get some concrete instructions for them. So if they give you the instruction, you got to go home and follow it. I know I did it for many years. I'll go to the doctor and they say, Felice, do this. Okay, this shit fell on deaf ears and I was on to the next one. Had I listened initially to some instruction, maybe, just maybe, I wouldn't have a few of the things that I have to deal with that I'm dealing with. So guys, be encouraged. Everyone deserves a good quality of life. Everyone deserves to be loved. And the other piece is intimacy doesn't have to culminate in a sexual act. Intimacy can just be affection. It can be respect. It can be enjoying each other's company. Intimacy is way bigger, but the sexual intimacy piece is a big piece, and I believe that you guys care enough about yourselves and each other to put some effort into it. So now, and as I mentioned before, a little quick recap with men. If you're going to the bathroom a lot, if you're urinating a lot and you haven't been diagnosed with diabetes, that's something for you to talk to your doctor about. If you're having burning sensations or itching, go see about yourself. It doesn't have to be diabetes, but it could be. Okay? If you're having issues with being able to maintain an erection, talk to your doctor about it. Be straight up. You wanna be better? Quit smoking. Cigarettes. Cigarettes can knock a tree down like nobody's business. If you're smoking cigarettes, tobacco, man, that narrows the blood vessels. And we know that the male organ needs blood to be in a situation where it can be utilized. Okay? So if you're smoking, that's an issue. If you're drinking, that's an issue. If you're doing illicit drugs, which I'm not your guardian angel, but it affects things. You got to be honest with yourself. Don't go to the doctor and then tell them some BS. And you're not being straight up, oh, are you smoking, Mr. Harris? Oh no. When your clothes smell like a damn tobacco shop. Sometimes I got to get hard on y'all. But it's only because I care. And I've had these conversations. You got to be authentic with yourself to make any positive change in any aspect of your life. So if you're urinating a lot and you've been diagnosed with diabetes, then you need to talk to your doctor about it and see what he wants you to do. I'm not going to try to tell you and treat you on a YouTube channel. That's just reckless. But I will point you in a direction to get some help. So if you haven't been diagnosed with diabetes and you're a man and you're urinating a lot, you're losing weight, you can't get enough to eat, you're having issues sleeping, you're feeling sluggish, your vision is blurred, and that's for men and women. You need to see about yourself. But one of the biggest concerns that, and we can't address that in a classroom setting. When I worked in a classroom setting, if I talked about that, I would have got fired. Believe me. So it was like, this is the only way I can utilize my experience as best as possible for you all. That's why I'm doing this. Because a lot of things I'm telling you right now, I can't do working for somebody in a classroom setting where you get in trouble if you say the word crap. I cuss on here. It's me. Because see, I'm no better than any. I'm a regular human being like y'all. I'm just who I am. We in the same boat. We trying to make it in a crazy world living with a chronic illness. Some of us have diabetes, some of us have hypertension, some of us have other things. But we need a doggone outlet. You need an outlet. You need to be in front of somebody who is authentic and who is an actual person who has lived and thrived with this. This is not information you getting off of a fake website or out of a magazine where they're showing some crazy fruit saying eat this and you're going to be cured. So now to the ladies, to the women. Like I said, thank God I ain't a man, because I would not want to have that pressure on me to be having okay, women, we have it easier. And I'm going to stop right there. But by the same token, we have it more, I think we have a more difficult time living with diabetes. When you're not diagnosed, when your diabetes is uncontrolled, women, because of how much the bacteria in the urinary tract for women and men, that's why I say if you're a man and you're itching and you're burning when you're using the bathroom, you need to go see about yourself, because you can very well be having diabetes. Women, it's the same thing. We get yeast infections. Yeast thrives off of sugar. Okay? You get yeast infections. You get urinary tract infections. Because the women's body is differently. The anatomy of a woman is so different, where we are more susceptible to infections in that urinary tract. So if our blood sugars are out of control, we may have yeast infections and God help them. That leads to burning and itching and what we call in a healthcare realm, excoriation, where you are essentially just raw and it's burning and it's painful because you got diabetes and it's uncontrolled. Women, and your partner wants to get intimate and you can't because you're so miserable. See about yourselves. Try to get those blood sugars balanced. I learned that a long time ago. And it was a very fortunate thing for me. And if you are just realizing that maybe this is worth getting a better balance with your blood sugars and following what the doctor's telling you to do to be well, then you might want to consider that. So we talk about the infections that women can get with diabetes. Also, we talk about neuropathy. Nerves. Like I talk about the nerves that allow the male to be prepared. And the female, the nerves allow for the sensation of enjoyment. And if your blood sugars are out of control, you ain't feeling jack. So it's like, why? You deserve to enjoy intimacy. You deserve to be satisfied. Your partner deserves to be able to satisfy you. It's give and take on both sides. It's about self-care. And women, you already know the kind of stuff we have to deal with most of our lives. It can be very, very difficult and very challenging. On top of having diabetes, I will say this. There are so many cases of undiagnosed endometriosis. I know I'm one of them. It is not normal for every menstrual cycle, women, for you to feel like you are dying and for you to be passing huge clots like liver. And I know this is graphic, but somebody got to talk about it. That is an illness that affects especially African American women. It's rampant in my family. But I didn't know until I was hospitalized. And my sister said, I had a 7-pound uterus when they did my hysterectomy. What? That's another thing. When you get together with your family, put your smartphones down and let's have a dialogue about what's going on, what runs in our family. I suffered unnecessarily because I was not privy to some information that should have been common knowledge. Think about that for a minute. On top of having diabetes, I said, well, I've been fighting this bully. I've been kicking this bully's ass for 45 years. So I got to pass on everything else. Well, guess what? Life ain't like that. So that's another thing. Talk to your people, especially women. We need to talk more about what's going on in our bodies so we can help each other. I hate a late coming somebody that come after the fact and say, oh yeah, I had that. Well, thank you. You could have told me 10 years ago. You didn't know that ran in the family? Lord have mercy. Anyway, ladies, a benefit of maintaining blood sugar balance is that you don't have to deal with yeast infections. You don't have to deal with urinary tract infections. So therein lies a balanced area down below. So when you do want to get intimate with your partner, the last thing you're worried about is having discomfort and or doing things and not being straight up with your partner about whether you being comfortable or having discomfort. And then other things accompany the fermentation of bacteria in the urinary tract. Think about it. This is another thing for the women. If you're a young person with diabetes, and when I do my segment on young people, I'm going to reinforce this. But if you're a young girl and you're living with diabetes, please be very careful about your sexual activity, because there's nothing worse than seeing a high-risk pregnancy, an unexpected high-risk pregnancy in a young person, a young girl with diabetes, more than likely it's a type 1. It is just a very difficult road to go down. So if you're feeling like you want to be in the times we live in, it's just the reality. Talk to your school nurse. If you can't talk to your doctor about it, talk to your school nurse. I know some wonderful school nurses. Because a high-risk pregnancy like that for a young person with diabetes can be life-threatening for both parent and a child. And it requires a lot of care and a lot of attention. And it's just a scary ride. So that's just my little brief message for young people. But again, women, there's another benefit in balancing those blood sugars. The beauty of diabetes is that it's very manageable. Understanding that and knowing that you can get it under control. You can get it balanced and live a happy life. That's the main thing I want you all to know. I hope that this segment was beneficial to men and women. And I hope that this might open a door for a dialogue. You know, it's difficult for the patient. We living with it. We have to deal with the disappointment, with the acknowledgement that we're not the same person, or we're functioning differently. From a psychological perspective, that's very challenging, you know. And if you feel like this segment, you want to watch it with your partner, watch it. There are a lot of things that people think other people realize or understand that they don't. You know, every day is an opportunity to make a positive change in your life. It won't happen overnight. You don't have to pressure yourself to do that overnight. The reason why I am focusing on that component is because it's so common and so prevalent, and most people are scared to talk about it, or they don't know how to approach it, or they're around someone who they don't really feel comfortable talking with. But it's just a part of the program. You do what you gotta do. You take it one moment at a time sometimes. Fortunately for me, I'm blessed with a tremendous significant other who has stuck by me through thick and thin, who understands my wellness, and we have a very authentic, straight up relationship where we can talk about what we're talking about right now. And we're friends. So, good luck. I hope this at least gets you all started on the right track. And hopefully this will introduce the door, open the door for some positive dialogue between people and their partners. And like I say, intimacy doesn't have to lead to a sexual result. It's okay if it does, and it's okay if it doesn't. It's just about taking time to understand where each other is coming from. That goes a long way. So thank you for watching, and I hope all continues to go well for you. And remember, questions, feel free to leave them. And please like and subscribe to my page. And I hope this really helps someone. If I help one person, then I have achieved something. So with that being said, be well until the next time. See you later.